All right, ladies and gentlemen, welcome to our sixth session of this Heart Health series. Today we're talking about diabetes, and we have two great presenters with us. You have Velma Glover and Idongesit Obeya who will be taking us through today's session. My name is Buba. I'll be in the background, just a techie guy today. And then today we'll be briefly covering Heart of a Giant Foundation. Your host today, we'll talk about some of the program elements that we that kind of making this health series happen. And then we'll dive into the knowing a little bit more about diabetes today. What is diabetes? The link between heart disease and stroke. So the link of diabetes to heart disease and stroke, taking charge to reduce your risk, and then some kind of call to actions towards the end. So before we got started, we just wanted to introduce ourselves a little bit, what we're trying to achieve with the initiative. So today, this health series fall part of the Healthy Heart Community Programs, which is an initiative from the Heart Out of a Giant Foundation. And our goal at the Heart of a Giant is to essentially help improve the health outcomes of people that have chronic diseases, but also the support system, so we can prevent and manage these conditions, and then as a community, but also helping us live our best life. And our specific focus with the Healthy Heart program is the focusing on preventing high blood pressure, but for those cases that have it, will help you manage it. And our focus is mostly on what happens in between a visit of the doctor. So as such, we collaborate with the community, collaborate with the resources, collaborate with doctors to improve their work, but also augment their work, but also improve the community health in general. And with and talking about community, all of this happen as a collaboration in general. So we collaborate directly with the American Heart Association. A lot of the content you will see today are from them. And then also we with the American Heart Association, we understand that there's an understanding that communities need their own solution. Communities are the best to inform their local solution. So they kind of that's how where the Empower to Serve initiative came from. So they lean on us, organizations like ourselves, closer to the community to inform, but also provide the information that is needed to the community. And our specific topic, of course, has been heart health in general. But then there's no heart health. When you talk about heart health, you know that there's other related conditions, and one of the biggest one is diabetes, which affects our community very much. So with that, we thought it would only make sense to include that in our series, and today we will be covering that. And like I said at the beginning, we have two great presenters, accomplished nurses with great experience that will be taking us through that. So I'll hand over to Velma and Idongesit to take it from here.
Hello, everyone. My name is Velma Glover, and I have been a nurse for 36 years, recently working in the school system. This topic is dear to my heart because I also have prediabetes, and managing it, through exercise and what I eat and trying to keep my weight down. So, is um, what is not what is no diabetes by heart? And No Diabetes by Heart aims to empower people living with type 2 diabetes to lower their risk for cardiovascular disease. And this is initiated by the American Heart Association and the American Diabetes Initiative. Our objectives are to know about its link to heart disease and stroke, understand how to take charge of your health to reduce risk, and know how to join the No Diabetes by Heart initiative. So diabetes is a condition that causes your blood sugar or glucose levels to rise too high. So your sugar levels are controlled by insulin, which is secreted by your pancreas. And, over years, I feel like we're a society that we tend to consume a lot of sugar, and sugar tastes good. People want to have great taste when they eat their food, but there's a consequence because our bodies wasn't designed to take in so much sugar, and it definitely affects our pancreas. So these high blood glucose levels can cause damage in different ways, and diabetes makes you more likely to develop heart disease or stroke. So, how it works: your body makes and uses insulin, which is a hormone, to keep your blood sugar in normal range. When you have diabetes, your body doesn't make enough insulin or can't use insulin efficiently. This causes your blood sugar levels to go too high. So, there's types of diabetes. Type 1 diabetes is one where it's controlled, like your body is not really secreting insulin, and it's controlled by you taking insulin injections. And it used to be that when you were young kids, you had type 1 diabetes. Now you see type 1 diabetes a lot, even in adults. And then type 2 diabetes is more controlled with, I guess, pills. Nowadays, we have all these devices that we put on our body to help control your sugar levels, and are given insulin through the devices. And then diabetes in pregnancy can happen a lot when a woman is pregnant and her blood sugars aren't being managed, especially during pregnancy when you have, the baby also, I guess, being able to feed off your body and everything, and just looking at how your body's working with managing sugar. It tends to be an issue sometimes with when you're pregnant. And when you're pregnant and you have diabetes, then studies have shown that you're more likely to have diabetes beyond the pregnancy. You're more likely to develop type 2 diabetes if you are Hispanic or Latinx, Black or African American, American Indian, Asian, or Pacific Islander. And I know for me, there's a huge cases of diabetes in my family, and especially for me, it's more since I'm more prone to it because of genetics, and even there's other things too in terms of lifestyle, your stress level, and just how you live your life will definitely affect your body's ability to manage your glucose. So some people are at higher risk. And like I said, in a family with a history of diabetes or diagnosed with diabetes with pregnancy, and not getting enough exercise, being overweight or obese, and then 45 plus, um, we're more likely to get diabetes. So, insulin is a hormone that your body makes that keeps your blood sugar at the right levels. When you have type 2 diabetes, your body cannot make enough insulin or is unable to use it the right way. Understanding the link. Living a longer, healthier life with type 2 diabetes starts by knowing the link to heart disease. People with diabetes have a higher risk of heart disease. When diabetes isn't managed, it can damage your blood vessels. So, damaged blood vessels are more likely to be injured from high blood sugar, high blood pressure, plaque buildup, and swelling in the arteries. The buildup of plaque can clog arteries, leading to heart attack, stroke, or heart failure. So, here are 4 questions to ask your doctor about your diabetes and your heart. What changes can I make to take care of my heart? What can I do before my next appointment? How will I know if the I've made are making a difference? And what resources can help me to learn more? So I don't know if you have any questions so far or any concerns as I've been going through the presentation. I do have some questions that are in the slides that we're going to ask. But diabetes is definitely a common thing nowadays in our society. And I know that the food that we eat, especially the processed foods and the lack of minerals that's even in foods that are grown now, it's affecting our body in a negative way. All right, so now we're at our video, and I'm gonna ask Buba, if he has a video to show.
Yeah, so I'll play the video here, and we've had a few cases where the link didn't work, so bear with me. If it doesn't, we'll figure out a way. It's a short 30-second video, so we should all be able to watch it well. So I'm gonna play from my screen, but I also share the link now for those that want to watch by themselves. All right, so let's go do this.
You've been diagnosed with type 2 diabetes. You have to carefully monitor your health for the rest of your life, and you have an increased risk of developing cardiovascular disease.
Type 2, take 2.
You've been diagnosed with a new purpose: to fight for the amazing life you made for yourself, to look that risk of heart disease square in the face and say, no, not me. You've been given a new opportunity to live. Get started at nodiabetesbyheart.org.
Awesome.
All right, I'm assuming everybody was able to see the video.
Mm-hmm. No,
we didn't see a video.
Now with Xfinity,
Yeah.
get gig
Okay,
internet, unlimited data with Xfinity Mobile, and you could save.
So I'll just give a quick recap, and then we'll continue with the presentation. So essentially, it was the beautiful Angela Bassett. My wife is a bit fast, so I can shout. But explaining that, once you get type 2 diabetes, you have to manage your life, monitor. But it's also a way to it's also an opportunity to live your life fully. So essentially, that's what it boils down to. I'll put the link in the chat to catch up on, and then we'll also send it up later. But yeah, I'll give it back to you, and sorry for the technical hiccup.
Okay. Let's see. If we could move the Booba, there's something that's blocking the your video clip information is blocking the slide. Okay, great, thank you. Okay. So whether you have type 2 diabetes or not, add these tips to your self-care checklist. So talk to your health care provider at your next appointment about ways to reduce your risk of heart disease. Make lifestyle changes, including following a heart-healthy diet, reaching or maintaining a healthy weight, being physically active, and not smoking. So, and Idongesit, if you wanted to add anything, I'm going to slow down so that if you wanted to add to the slide, then feel free.
sure. Do you mind if I add on now?
Sure.
Okay. So hello everybody. I'm so happy to be here with you all. Please ask questions. We're all learning together. And it's not easy to have the diagnosis of diabetes or even pre-diabetes like Velma stated. It takes a village. Often people feel alone in learning about either managing or avoiding that diagnosis. um, the benchmark that were set, say 30 to 40 years ago, are being blurred these days. And Velma so eloquently touched on it, because the foods that we're eating is not of quality, and we're increasingly seeing, diagnosis benchmark blurred, like type 1 diabetes. Was commonly referred to as juvenile diabetes, which was usually seen like in children from birth to maybe about 18 years old. But actually, as of last weekend, I have an adult woman who is, I think she's like 32 years old. She has two children that has been diagnosed with type 1 diabetes. So her pancreas is not producing insulin at all at this point. And thank goodness for her relocating to America from an African country, and that was like a pivotal point to save her life. Children, are now being diagnosed with type 2 diabetes, which is commonly associated with, lifestyle choices or food choices or sedentary lifestyle. We're not moving much as nature would intend us to do. So we're finding that, more and more people are being diagnosed with, conditions that, normally was not seen in people in a certain category. So it's not easy to make changes because we're creatures of habits. We grow up eating a certain things or living a certain way. And then when we find out that is affecting our health, we have to adjust. So I'm learning as much as everybody here, and I'm reinforcing, the behaviors that I already know do not serve me as much as everybody here. So I think this is really great.
Hmm. Definitely, I see some of the questions in the chat, and lifestyle makes a big difference with diabetes. And again, the how active you are. And I know we just, with the pandemic, we went through the change of being at home and, sitting at the computer a lot. We do a lot of Zoom meetings, and it takes a more conscious effort for us to be more physically active, especially when we're at home. And so definitely that's a key one. And I knew when I grew up, we were outside all the time playing, very physically active. But as an adult, you have to go to the gym now, and so definitely that's a big one. I think is your physical activity. It makes a big difference. Let's say whether you have type 2 diabetes or not, add these tips to your self care checklist. Stress. Oh my goodness, we have been through so much stress just with the whole pandemic. And managing your stress definitely means like more self-care. And some of us, like, we're so busy with the kids, our family life, and then balancing our job. And a lot of times as parents, we don't take that time to just give to ourselves. And it's just so essential for our well-being. Being able to monitor and keep track of your blood sugar, your blood pressure, your cholesterol, and weight are also definitely key things. I know a lot of people, it's more of like when they're in certain programs that are looking at that weight, that it definitely helps them to be on top of it. But we don't have to be a part of a program to really look at our weight on a at least weekly basis. And I mean, I know for me, my weight, I feel it when my when with my clothes, that my current clothes, and I'm picking up weight, things don't fit, So it's like that's a big key for a lot of people, is looking at how your clothes fit. But for you checking your blood sugar, unless you already have diabetes, then you may have a glucose monitor to check your sugar. And then cholesterol, definitely a lot of times you get that done when you have your yearly physical. And nowadays, a lot of people have their own blood pressure cuff. And I believe if you are a member of this program, if you don't have one, I believe you may get a blood pressure cuff so that you can, be checking that. And then staying on top of your medications. I know for me, what helps me is definitely having a pill case and putting my pills out weekly. And then that definitely tells me when I forget, that, oh, I didn't take it this day. But being able to do things to really help yourself to manage just good control of being on top of your medicine. All right. Time for a small quiz on diabetes and heart disease. Let's see. Okay. All right. Question number one. Seeing your doctor regularly can help you manage your diabetes. Can you put in the chat whether that's true or false? I'm not sure how many people we have on, but
Yeah, we have a couple of people, but I think yeah, once we have one or two answers, you can kind of move on. So yeah,
okay. All right.
most of the people will be joining remote on demand, so they will probably see that they will do a self test on that.
Oh, okay. Okay. Well, you're right. Everybody answered true, and that is definitely the answer. We definitely having the support of just the information that's given to you from your provider or your nurse definitely helps us to regulate ourselves. Next question. People with diabetes are 2 times more likely to develop complications from heart disease. Again, can you put the answer in the chat? Definitely, that is true. Do you have anything, Indonesia, to add?
Yeah, so it was touched on by Velma that diabetes actually affects everything in your body. So um, I don't know. Well, actually, I do know this. I mentioned this last week when we had our class. Everything in moderation. Too much of everything is bad for you. So when you have a lot of sugar circulating in your body, more than your body needs, it accumulates and causes things to accumulate in your body. Things like plaque, which is a derivative or like oils that you eat. It starts to accumulate in your blood vessels, like your arteries and your vein. So instead of them being nice and round and enough passage to blood to flow through, it narrows it, which can lead to heart blood pressure, blood clots occurring because the blood cells are bumping into each other, causing bruising and then clotting over time. So yes, when you overdose your body with something that yes naturally is good for it, but in too much of a high concentration that it cannot get rid of it, it does affect you in so many ways. It affects your heart, your kidneys, you name it. So yes, that is
Mm,
my contribution to that quiz question.
yeah. I mean, I definitely know a lot of people that, even though they know what's right to eat, they tend to eat by the occasion. If it's the birthday or family party, then they want those extras. It's just, that's how you socialize. But yeah, definitely when your pancreas isn't working too well, you're gonna feel the effects later. Question number three. Managing your diabetes can be stressful. You can again put your answer in the chat. Mm, yeah, definitely that is true. And I know that, you know, pricking your finger to find out what your blood sugar is not easy. Um, and I think that when you have to do it, you kind of get used to it.
Mhm.
But I know there's times when I've had to prick my finger and I'm still jumping, because feeling that prick is not something that feels well to me. Um, but yeah, it is stressful because you do like, when you have the social gatherings, you just can't go and do what you see everybody else doing. You have to really think through for your own life, like what you're going to eat and what you're not going to eat. And then people may impose, and you have to say no and feel good about it. And yeah, you have anything to add?
Yeah. So when we talk about diabetes, I think oftentimes, people think it's just limited to, kind of like testing your blood sugar and then taking your medication. It engulfs your life, everything that you do. Your stress levels, you have to control that. Your triggers, your stress triggers, you have to, be aware of that so you can control it. Your eating patterns, your eating habits, you have to modify all of that. Your activity levels, you have to modify all of that. So it takes every single aspect of your life into managing. When it comes to managing diabetes, it feeds into everything. you know um Imagine you are in a family of say 4 or 5 people, and you've been accustomed to eating a certain way, and all of a sudden you have to change that. It is stressful if you're the caretaker in the house and you're responsible for cooking the meals. So you do know that you cannot partake of the meal that you're cooking everybody, because your family's taste buds, wants a certain, they're accustomed to a certain kind of way of cooking. You have to cook differently. You have to modify salt. You have to modify sugars in what you drink. If you are drinking juices, you now have to drink water or more natural juices, and also be aware of how much of that you're taking in. You have to be aware of your snacks. So you can't just eat chips just because you want to eat chips. You can't just pop in a mint or chew just on any gum. So it is stressful when people have to actively modify every aspect of their lives.
Mm.
Over time, it gets easier. For somebody like me, I'm a very good nurse when it comes to giving insulin and doing needle stuff, but when on the receiving end, I'm not so good at it. So it's stressful having to think about the needle pricks. It's not a big deal, but over time, you can get used to it, but it doesn't mean it's not still not traumatic. And if you have to inject yourself, give yourself insulin subcutaneously, that is another aspect that you will have to get used to over time. But the initial stress is there. So it's not an easy journey. That's why it's good to see your doctor regularly and have a support group or a person or two who can support you, even if they get it or not, even if they can relate or not. If you have a good village, it helps manage it.
Mm. Yeah. Yeah. So I've worked with the school age children recently. And so, I have parents that they would prefer their child to be a part of any kind of parties and stuff and let them eat what they want. But to supplement or to help them with that, then I had to just give them more insulin. So a lot of parents, they don't want their child excluded from what everybody else is doing, and we just have to compensate for the extra sugar by giving the insulin. So yeah, people manage it in different ways, and lifestyle is everything, and especially with children, you don't want them to feel so isolated, um, and you want them to be sociable and okay with who they are, even though they might have a disease that's really controlling their abilities to be at their best. I believe this is the last question. I can never eat anything with any sugar in it ever again. Is that true or false? Can you all answer that in the chat again, please? Yeah, you're right. It is false. It as we already talked about, I was working with a metabolic doctor, and I was only supposed to have no more than 25 grams of sugar per day. And you think about how one piece of cake could be 25 grams of sugar, or the juice that we drink can be what, 30 to 45 of sugar. um yeah, there's sugar is the content of sugar. If you just start looking at everything that you put in your mouth
Hmm.
and the carbohydrates that is there, like, you're like, it'll just blow you away to really look at how, wow, I've been eating all this sugar all the time and not even recognizing it. And I constantly, like, sugar is like an, you get
Everything.
addicted to sugar. You
Hmm.
know, it's like your taste buds, once they get there and they like the sugar, like, you just want to continue to have it. And to all of a sudden find that you have diabetes, and to like look at, okay, now I need to really control and not eat a lot of things. It really takes I know for me, some psychological help to really look at how to manage, or like, I'm an emotional eater. And there's a lot of people who are emotional eaters, and that it comforts them. And to be able to like look at, okay, well, how do I provide comfort? How do I understand my mentality and how I respond to things, and deal with it in a way that helps me to manage and keeps myself healthy? Do you have anything to add?
No, that it's just it's scary because I am very conscious. I'm a conscious learner. It will help if I put everything in practice, but I don't. You know, I was listening to somebody this morning, and it's very true. I've heard this before, and I know this to be true. But a statement was made that most of the chronic diseases that we have today is self-inflicted. Especially with, like, related to cancer. Sugar is the number one culprit, and it's been studied, it's been researched, it's been proven. And again, everything in moderation. A lot of the fruits and the vegetables we eat have naturally occurring sugars, right? So, and in addition to all of those, we then have everything that is infused with sugar, including pasta sauce, including a lot of the dressings that we eat, including a lot of the juices or the fruit juices, the fruit concentrates that we use. So the hidden sugars in almost everything, even the breads, the cookies,
Mhm.
um, the
Yeah.
gums, the hard candy, things that we put in our mouths. We don't really consider them foods when we're asked to keep a food diary, but all of these things matter. Sugars and salt, they're hidden, they're infused, they're added because you know what? Velma just stated, we have developed this addiction to these substances without really thinking about it. So our bodies naturally crave it, and it's comforting when we have them. So now, when we are faced with a decision to modify our lifestyles and our diets to healthy alternative, it feels like the world is ending, right?
Mhm.
And most of the times it's not that serious. I think, in this case, this will help us, in a sense, be empathetic to people who are addicted to hard substances. They feel they need it, but do they really need it? We feel like we need all these added sugars, additives, and things that we've introduced into our bodies that we've become addicted to over time. But we can change that, we can modify that. We can train our bodies to come away from it. So that there's a lot to learn, there's a lot to consider, and there's a lot to implement in our daily lives.
Mhm. Yeah, and we can't negate the fact that businesses want you to buy their products. Okay? Things are marketed in a way to be in our minds, in a subliminal way,
Right.
to say that yes, we should take this. And so I think being aware of how things are marketed and also what's available most.
Mhm.
Because a lot of times when you want to buy better food, it's more expensive. And being able to choose, um, things that aren't so expensive. And I know that someone had talked about the environmental work group and how they look at um, the things that have more pesticides in it, which has an effect on our hormones. And so to be able to look at just the how things food is processed, and being able to make wise choices as a
Mhm.
result, it takes us being like understanding not only our desire, but also what's helping us to continue to do what we do.
Mhm.
And we live in a capitalistic society, so that it's about marketing, it's about you buying the products. And yeah, so that businesses are making money. And so when you consider all of that, then being able to say, okay, yes, I saw this commercial. And a lot of times the commercials, they just have this subliminal effect on your brain, and kind of gives you that desire that, oh yeah, maybe I should go to McDonald's, and oh yeah, they have the new products, it's seasonal now. And to be able to understand how that is affecting us and making us, in spite of what the knowledge we have, but it's still allowing us to like go ahead and consume it anyway. And that's a big part too. um there was someone else had shared with me how even when you go into restaurants, like the kind of lighting, like
Mhm.
when you're in an environment where you're just more relaxed, and how you can consume more, being in that kind of environment as you're just talking. And so there's definitely a lot of factors that go into helping us to eat things that we know that we really shouldn't consume. But yeah.
Yeah, just to add to that, Velma, you make incredibly, incredibly useful points. Just to add to that, that things that are placed psychologically to influence our decisions. There's a budget tip, that is very common that goes around is that if you're going to the grocery store, the one way to avoid overspending is to go into a grocery store with a list of items that you want.
Mm,
Apply
mm,
that to food choices. If you're going out with friends, you're going out with family or whatever, you're going to a restaurant, have it written down because putting it here can have you forget. Have like a running list of healthy food choices for the restaurant. Try to view their menu online before you actually set foot in the restaurant. Have an idea exactly what you're going to order. So by the time you get there, you stick to that choice. You're not making choices based on emotions, based on the psychological tools that have been put in place to influence you, right? You're
mm,
walking into a grocery store, is the restaurant is the same as walking into Walmart, ShopRite, Giants, King's Colon, whatever you have, by you, walking there with your grocery list of foods you're going to eat on this outing, which is healthy. I'm not saying if somebody tells you, hey, try my spinach artichoke dip, you don't try it. That's not what I'm saying. If you did not have spinach artichoke dip on your list of what adds up, what is healthy, what is not healthy, do not order it. So it's just a tip. I'm hoping it's useful.
And to add to that, make sure you eat before you go to a grocery store. Don't be hungry when you're there, because you're gonna have the nice candy bars at the register, and there's gonna be stuff that's really enticing all around you to like say, "Oh, I'm hungry. Let me just have that." So definitely, that's another planning is to like make sure you eat before you go to the store.
Uh, Good one.
That's a very good one, especially when you go with kids. Um,
Yeah. Yes. Yes.
you risk losing it too. So yeah, thanks. That's a
Yeah.
All right. Actually, question 5, it says adding some movement to your day is a way to take care of your diabetes and your heart. Is that true or false? Yes, yes, yes. Yes. movement. Oh my goodness. I don't know if everybody plans their movement for the day, or is it just, I know Monday to Friday, a lot of us work, and, some of us have jobs where we're up and about moving all the time. And then other of us have jobs where we are sitting most of the day. And I know for me as a school nurse, then there was a lot of data input that I had to do. And I was sitting a good part of my day. And I had to consciously, like every hour, just make sure I stand up, move my arms, move my legs, even just for 5 minutes, walk away. And I try to do that even when I'm at home. I tend to be more relaxed when I'm at home. But yeah, planning your movement is also key. Getting that cardiovascular and as well as the resistant training. As you get older, we lose muscle mass, and you got to get that resistance, lifting weights and stuff into your day too, at least 2 or 3 times a week. It definitely makes a big difference. Do you have anything to add to this?
No, I agree. I agree. I think one of the best invention, especially in the day of the virtual work life, is a standing desk. They're not the
Mm,
cheapest thing on the market, but they're very useful. Our bodies mechanically was not built to sit for 7, 8 hours, 6, 8 hours, however many hours you work. You know, it causes breakdown in muscle, skeletal structures, and everything that supports it. So if you can afford a standing desk, if you're um, a person who works with data a lot, please invest in it so that you stand every 30 minutes or every hour. You just elongate your body and stand and move in a way where is anatomically correct and beneficial to you in the long run. Movement, move your arms. Recently, I've been using the cold as an excuse, but recently I've, consciously introduced walking into my routine. The one day I decided to walk, I'm like, you know what, maybe I will do a mile. And at the 1 mile mark, I'm like, you know what, this is really short. Let me just keep going until I'm tired. I ended up walking 5 miles, and I was so proud of myself. And I felt like I could still go more. So when they say mind over matter, that is really a thing. When you think about the numbers, it sounds scary. Just go with your body. If your body's willing to do it, your body can do it. And just squeeze that in. Is self-care, is therapeutic. If you have a park close to you, just go ahead and do it. Did you crawl back home? No, I walked back home. It can get I mean, being healthy is addictive. It can get addicting once you
yeah.
see the benefits or once you feel the benefits, because you do feel it. You feel good, you feel lighter, you feel like you know bubbly. I'm already bubbly. I didn't need extra bubbles, but here we are. But it does feel good over time. It's just that initial breaking through that mindset and getting it done. So moving helps. It does.
Yeah. I don't know if you've seen this, but now they have the desks with the bikes added to it. Like you could like ride your bike as you're sitting at your desk now. I thought that was so cool.
Yeah, it's expensive though. So
Yes, $300. Yeah. All right. All right. Know Diabetes by Heart provides the necessary tools and resources to drive more informed conversations between people living with type 2 diabetes and their doctors. So you can go to knowdiabetesheart.org to learn more. Call to action. Learn about diabetes and its link to heart disease and stroke. Pick one of the 5 simple steps to take charge of your health and start it today. And visit knowdiabetesbyheart.org to learn more and join the initiative. and join the 2HC program, heartofagiant.org slash program. And it's a wrap. We definitely appreciate your thoughts. I have a question that I would just love to hear your results of everyone. When you think about health and well being for yourself, what does that mean? What does health and well being for you mean? And I think about for myself, I think about just not waking up and not being in pain for the day. I think about just feeling good in general. Exercising, oh my goodness, I just sometimes it's painful to get to the point of doing it, but when I do it, I just love it. So what are things for you that helps you or look that helps you to look at what health and well-being? Maybe we all can answer that question for ourselves because when I was at the school, I would ask people that question about health and well-being, and a lot of people don't think about their own health and well-being except when they're in pain, when they're not feeling good. That's when they think about it. But what does it mean to prevent yourself from being in pain and having different symptoms? What does health and well-being mean?
Can I chime in here?
Sure.
For me, it's
Sure.
general vitality. I think we are such a um, plan focused driven society that we feel everything has to be planned out, and if somebody's not able to plan things out because of either jobs or family responsibility, they feel very bad that they're not doing enough to keep themselves healthy. Going to the gym is beautiful, is a wonderful thing, but that's so is dancing to either soca or 70s music or rock and roll or whatever in your living room or in your workstation or whatever. you know um, we we have to come to a place where we meet people where they are. Traditional African music is very upbeat. Okay, Caribbean music is very upbeat. You think about some you know high life or disco music or whatever. They have elements to them that a person can move to. So if you move to any of those music, being it bopping or whatever it is, for an hour, that is physical activity. You don't have to go walk 5 miles like I crazily did the other day, but you can move. I think American Heart, it's an American Heart or Diabetes in a society. They have like a standard of 90 minutes of physical activity. I think in a day or in a week. It's enough to help you kind of keep things at bay. So if we think about vitality and well-being and health in just basically meeting people where they are, I think most people will be compliant with that sort of a thing, as opposed to, oh, I have to go to a gym, get a gym membership, go out at 6 a.m. to work out, or work out after work. After work, you're not catching me working out for anything. I'll speak for myself. My brain is exhausted, I'm physically exhausted, I'm done. Right? So working out or doing something active in the morning before you get into corporate or whatever work that you do will actually set the pace for your day. It will help those feel good hormones, oxytocin, you know power you through the day. So just a tip in addition to the just to contribute to the question that you asked, please don't feel pressured to go sign up for a gym or whatever. I had a doctor recently that basically told me, hey, this is my goal for you when it comes to weight loss, right? But the last thing I want you to do is go get a gym membership. I looked at her like she was crazy, like, okay, where are we going with this? She's like, okay, I'm going to prescribe something maybe nobody has ever prescribed for you. Go in your living room in the morning. You can be in your underwear, put on some African music and dance to that. Dance to that for 30 minutes to an hour. every day, and you're going to attain the weight loss that you're striving for. And also modify your diet. Eat half of everything, start with half of everything or quarter of everything, and that is how you go about it. So learning to identify where you are and making small changes will make a long-term commitment to making a lasting change. That's just
Mm,
my feedback.
Thank you, Idon.
awesome.
I want to put Velma on the spot here. I think she didn't add that in the introduction. I expected her to add that, but she's also a health instructor, sort of like in terms of yoga, and you're part of the Codman Square. Is it Codman Square? There's
Yep.
like a nice activity. So, which provide a community and everything. So I wanted, if you could tell us a little bit about that, and then that's some of the information we're gonna be sharing with people. So you can do like yoga remotely, but also in person. So Velma, can you tell the people a little bit more about that?
Okay, yeah. I also work as a yoga instructor, and I'm currently working at the Four Corners Yoga and Wellness in Dorchester on Washington Street. And there we offer yoga classes, several different types of yoga class. We offer massage. Um, I also do reflexology. And so reflexology is your organs are reflexes are all in your feet. And so with reflexology, then what happens is it stimulates relaxation to actually manipulate the reflexes in your feet. You can put you in an alpha state, just helping you to reduce stress and help your body to just rejuvenate. And if you never had it before, it's a wonderful, wonderful experience. And back in the day, thousands of years ago, they did reflexology a lot. And but with current medicine, that's not the suggested way to help improve your health, but yet it is alternative method to add to just whatever is your doctor has prescribed for you, and just helping you to reduce stress. And now that our stress levels been so high, we need to actively think about you know doing yoga and just doing things that really help us to keep our stress level down. um, so yeah, so that's definitely one of the I mean, for me, I've learned as a nurse to not just as a nurse, but in nursing, you repress your feelings a lot so that you could continue to take care of your rest of the patients. Like, you got to get through your day. And when you hold on to those feelings, then sometimes you bury those feelings alive in your body, but it sits in your organ and it creates distress in your body. And it's real important that we release tension and stress in our body on a regular basis. Did I
Thank
forget
you.
anything?
Yeah. So we almost to the hour, and of course, these discussions will keep going. We're gonna have some follow up series. I think I already made note to have more discussion around diabetes, and also diabetes and the intersection of with eye disease. So I wanted to, maybe if you two, both of you had a last comment or last word that you'd like to share. We'll go with Idong first, and then we'll have Velma close it out, and then I'll just come around and thank everybody for being with us this past 6 weeks. So So what are some of your last words or last recommendations for everybody? And Idong, you can start us off.
Okay, thank you. So my this last past 6 weeks has been wonderful, great. Just I can't really put into words. Is one thing to commune with people who are eager and willing to learn and make changes. The one thing that I would say is that nothing comes easy. It takes effort, it takes commitment, you know, and you do have a village here in Heart of a Giant. You have support here. We're here to support you. All of us are well versed in our area of expertise, and we've had experiences across specialties, and dealing and helping support people wherever their level of need may be. right? So it's not easy. Don't go at this alone. It can get lonely when you feel like you're making effort but not really seeing much of a result. It takes time. It takes time. We're here for you. We're here to support you. We're here to share knowledge with you, and we're also here to share your frustration, whatever it may be. We'll listen, and whatever tools that we know and we've used in the past, we're here to also help lift you with that. So we've covered heart related diagnosis and diseases, salt, sugar, diabetes, so many other things in between, signs of strokes and things of that nature. It can feel overwhelming. Please do not feel like you cannot reach out to ask a question. No question is disregarded. um, we're here to support you. So thank you for giving us this opportunity to share our knowledge and to meet with you. It really means a lot.
Mhm. Yeah, I'm definitely in agreement. I mean, I feel like we are definitely here to support you. I feel like there's also a wealth of knowledge here and of experience, and there's definitely a lot of resources. I think Boo Boo is going to include some of the resources. I have information on hyper and hypoglycemia, like blood sugar and high blood sugar, and then looking at knowing your numbers in terms of your A1C, which is looking at your blood sugar over a period of time, and just being able to stay in control over that. Looking at your blood pressure constantly. Also, when you have diabetes, your feet are um, can go through some challenging things, and
Mhm.
being able to check your feet on a regular basis, and your kidneys, and which your blood pressure, which goes along with your kidneys, and just issues you might have with your kidneys. And yeah, so there's going to be resources that Booba gives out on the information that I have set out. And just looking at, there's one on diabetes, heart disease, and stroke from the National Institute of Diabetes and Digestive and Kidney Disease that I think is really, has a lot of good information in it. And so I too thank you so much for this time. I feel like it was definitely a great review. Like I feel like as nurses, we learn a lot, and then we work in specialty areas, and then we forget certain things. And this was a great time to be able to review stuff that's really important to our well being. So I too thank you for this time.
Thank you so much. You guys have been great presenters. So and as a team, I think it's been great. I like the camaraderie, sometimes at my own expense, but I like the relationship and supporting the community. And I think you've shown the value of a community and how how to also build a community. So for me, that's kind of what I wanted to start with. But to wrap up, what we've been through these past 6 weeks, and obviously heart disease or even diabetes, nothing can be covered in a, let's say 6 hours or six hourly sessions. But my hope is that we've given everybody an overview, but also introduce ourselves to everybody to understand that, like you said, we are here for each other. We'll be here to translate some of those resources as needed, some of the questions, but also be here to advocate for you, and so on and so forth. So we covered a lot of great information, great discussion. Like there was an overview on control your blood pressure by Idong herself. We've had Maria, we have Jessica on the call, Charlene, we've had Unid and Velma, we had Sarah. I'm sure I'm forgetting somebody, but great people in the process. So we've covered like what to eat, what to avoid, and some of those things. And I think just like today, it's a reminder to us that all of it is connected in a way, and there's some interaction between these conditions and different part of the body. So not looking at any of this situation in isolation. Just like don't try to go at it alone. You
Mhm.
always have a resource in your community, or in us or in other people other areas. That also is you're not alone in this journey. It's really these are widespread
Mm-hmm.
widespread conditions. But the good news is that we have a lot of the tools that will help you address it and pretty much live a great life. Just like Idon case is here, continuing to be bubbly, and then Velma's case is being a yogi. It's just amazing. But yeah, so you can continue to live your great life. And in my case personally, I was diagnosed with my heart condition in 10 years ago, actually 2012. It was a congenital condition, which I was born with it. I didn't know. 2 years ago, we found out that it was a genetic gene modification that caused it. But all that, in my case, let's say past 10 years have been great years for me. I've been able to have the support around me. I've been able to have friends, community, and I can only say I've been really happy. So being healthy is definitely related to that because without that I couldn't be able, without being relatively healthy or healthy I couldn't do any of these things. And that's ultimately our goal. We want folks to be fulfill their potential, be their best, come as their best, and then as a group, as a community, we will rise and be the best we can be. So with that, I would really thank everybody for joining. It was great. And then if you're watching this replay, keep watching it, keep sharing it, and we'll keep in touch. And then look out for the next series that is coming. We've heard discussion suggestions for other languages. We've had discussion for deeper topics. So all of that will be communicated at a later stage. So I'll pause here for now and really say thank you, everyone. It was great having you all. And lastly, happy birthday, Idong.
Thank you.
Birthday.
Thank you.
Bye-bye. Thank you.
Bye, everybody. Thank
Go,
you.
go celebrate in a healthy way.
Yes, yes, yes. I didn't start off correctly, so the day's still young.
Okay.
You have time to redeem yourself, so go get it. We're watching it, so now we have you watching it. I'm gonna call my friend to get some tips. Be like,
Right.
spy on you. I'm like, has she been doing the right thing? You can't tell me to not eat sugar and then you go eat the beef. We're watching it. All right, take care, guys.
Thank
Thank you so
you.
much. Thank you very
All
much.
right.
Thank you,
Thank
Idong.
All right.
you. Bye,
Take
Bye bye.
care.
everybody.
Thank you all for
All right.
attending.
Bye.